Hello from ZTN Studios in Harare, Zimbabwe. Welcome to the Mint Special. Our discussion today, devolution in the context of COVID-19. This broadcast is brought to you by Zim Paper's TV network, ZTN, and our partners, the National Citizen Devolution Task Force, represented by the We Pay You Deliver Consortia. Hello, I'm Andy Hodges. The COVID-19 pandemic has made it apparent that most social services are centralized in Zimbabwe's capital, Harare. In the country of 14.5 million people, Zimbabwe initially had only one testing center, located again in the capital, until one was established in Bulawayo, the nation's second city, on April the 12th of this year. That means blood samples of suspected COVID-19 cases from across the country were being sent to the capital across the country's inadequate road system. The Constitution of Zimbabwe 2013 recognizes devolution as a key component. In fact, the concept, which translates to provincial and metropolitan councils undertaking social economic development in their respective provinces, is also identified as one of the founding values and principles to the Constitution. Devolution is a necessary vehicle for doing away with the over-centralized system of government, for deepening democracy, promoting locally driven development, improving the delivery of public services, and promoting national integration and peace while recognizing diversity. So how come the service delivery is still centralized in Harare, 7 years after the Constitution was adopted? Zimbabwe's 7-week lockdown was indefinitely extended recently, subject to 2-week reviews. What will this mean for all the other provinces? Will this finally force the government to execute the statutes outlined in Chapter 14 of the 2013 Constitution, providing for provincial and local governments? These are questions that need extensive discussion and action. Civil society has come up with the Citizens Devolution Task Force to spearhead this conversation, and today we have members of the task force to help us discuss these questions. Joining us on our show today to discuss devolution in the context of COVID-19, we are joined in the studio by David Matumbike, National Coordinator for the Local Governance Trust, and Lorraine Mupasiri Sani, Director, Combined Harare Residents Trust. Ladies and gentlemen, welcome to the Mint Special.
Thank you.
Thank you.
Now then, if you have any comments, please, on this show, contact us via our Facebook page at Zim Paper's TV network and via our Twitter handle at ZTN News. Now, David, let's start from the basics. What is the role of the National Citizen Devolution Task Force, and how did it actually come into being?
Okay, the National Citizens Devolution Task Force is a task force which was mandated by a cluster of civil society to spearhead lobby and advocacy for an inclusive implementation of devolution according to the Constitution. And this task force was formed at an Indaba, which took place in 2019, which was attended by a broad spectrum of organizations from government, civil society, academia, and also we had some international experiences from Kenya, South Africa, to deliberate on how to go forward in terms of implementing devolution. And it was in the civil society cluster that this idea of a National Citizens Task Force on Devolution was mooted to really make a collective effort of lobby and advocacy for an inclusive process of implementation of devolution.
Now, I mean, it's interesting because we're now at the height of the COVID-19 pandemic, okay? So why do you think, of all the other issues we have in Zimbabwe, why do you think it's important right now to focus on devolution?
It becomes even more important because devolution is about bringing public services closer to the people. And when we're talking about these services, the most critical, which are provided by local authorities, are the social services like your water, your health, and your primary education, and roads. So these are services which are very critical to everyday life of citizens. And as you know, today we have COVID-19, and water is a very critical element in terms of prevention of COVID-19. And
you have to wash your hands, don't you?
Yeah. and health also. When all these services and their delivery is being delivered from a central point, it becomes difficult for these services to reach the people. So this COVID-19 has actually, shone a spotlight on devolution, to say this conversation that we've been having becomes even more important. Yesterday we had your cyclone Idai. Today we have COVID-19. Who knows what we are going to face tomorrow, and if these bottlenecks continue to exist in terms of delivery of services to the people, I think we stand to lose a lot, and in this case we are losing lives.
Lorraine, I think David said it very clearly there about water. I mean, anyone who lives in Harare and even Bulawayo, and in fact most major cities around the country, understands water is a big deal. And under COVID-19 it's very important, of course, because we're told wash your hands for 20 seconds. Now, the Combined Harare Residents Association, CHRA, as a member of the task force, has been in the forefront of lobbying the city of Harare and government to enable the delivery of adequate water supply to households during this period. How do you think devolution can resolve water capacity challenges that the city of Harare and other local authorities in the country are facing?
Firstly, the advantages of devolution is that it allows the government to decentralize some of its functions, authority and administrative powers, to sub-national governments or local governments like the Harare City Council and all other local authorities. So when that is done, it helps the local authorities to make their own decisions. So it is important because, firstly, it also addresses the current challenges that we are facing in terms of approval of budgets. It removes the bureaucracy aspect in terms of approval of budgets, resource allocation, and so forth. And you find that the current water challenges that are being faced by most local authorities, they are as a result of centralization in terms of administration of water resources, administration of service delivery in terms of water. So devolution now empowers the local authorities to make their own decisions, to raise their own funds, to be responsible even for public procurement in terms of addressing the water infrastructure. Currently, the water account is centralized in Zinwa. It's for catchment councils. And you will find that as a result, the catchment councils do not have much power in terms of determining how those resources are supposed to be, used. So this has also created some of the challenges that we are seeing in terms of water challenges, where we see the local authority is demanded to deliver water, but they do not have much power in terms of determining how resources that address the water challenges should be used.
I want to throw this into my next question, because you've raised some very good points there. And it appears that in the 2020 national budget, much of the 5% of the total budget dispersed as devolution funds will be utilized to address water and sanitation issues. So there's a couple of questions I have there. First of all, of course, is this enough money? I mean, that's number one. And secondly, you talked about how councils needed to have their own power, or the power to be able to spend that money how they wanted to create better delivery. Do they have the capacity to do that? We don't want to see leakages, if I can call it that, of devolution funds going through councils, which has happened in the past.
I'll answer the first question first. Is it enough? The 5% is not enough. Why is it not enough? Because it is also supposed to cater for other service delivery aspects, for example, health, education, and so forth. So it is not enough. Maybe if the government could increase that allocation to around 20%, and then from that 20% allocate a certain percentage towards water. So what I'm saying here is that there is need to ring fence water accounts to ensure that the money that is for water is also not used for other service delivery issues. Because in terms of service delivery, you find that water is a central issue in most local authorities, far above any other service delivery issue. So there is need to ring fence, and there is need to increase that allocation, because water is a capital project. For Harare right now, they need the building of more dams to ensure that water delivery is adequate. Lake Chiveru is no longer adequate for Harare due to increase in population, and that there are other satellite towns that depend on Harare. So there is need to increase that allocation. And then secondly, what was your second question?
In terms of the capacity, we don't want to see leakages coming out of the councils, which has happened. I mean, let's be clear.
So now the fact that the devolution framework is now enshrined in the Constitution, it puts an obligation on the government and other relevant stakeholders to ensure that the different institutions that should be responsible for the implementation of devolution are capacitated. And this includes the local governments and the local authorities, the local boards, and so forth. So in terms of the commitment of the government, what we need to see is to see them, coming up with the programs to capacitate the local authorities so that they can be able to implement the different aspects of devolution. You find that countries like Kenya, when they came up with the devolution framework in their constitution, they immediately set up a task force where government was also involved and civil society was involved. They came up with a ministry that is responsible for monitoring how the local authorities, or in Kenya they call them counties, how they are implementing devolution, how they are using their resources, even some of the resources that come from government, in terms of accountability and transparency and so forth.
Now, I think Lorraine there makes some good points, David. Legislative framework, the capacity for government to make sure devolution actually works. It doesn't really exist at the moment. In terms of, it's not as tight as we would like.
It's certainly not as tight. And the issue of devolution, 7 years later, we're still talking about it. Granted, there might be challenges here and there, but certainly we are not seeing a systematic approach to devolution implementation. It seems to be very ad hoc. Yes, the government has set up an interministerial committee which is chaired by the president, I think deputized by...
Which shows the seriousness, doesn't it?
Okay, what they're calling the Second Republic, yes. There's some form of political will. But here's where my question is. I think there's a problem with an interministerial cabinet committee driving the process of whole state redesign. Where they are an interested party, our argument is to say you can't play both referee and player. There's need for an independent institution which must be put in place to drive the process of devolution. Why not have an independent commission, a constitutional commission, to drive that process so that government can also sit at the table at equal level with the other tiers of government, local authorities, provincial governments, and citizens. Because at the end of the day, devolution is about the service delivery. And unfortunately, to a certain extent, it has been politicized here in Zimbabwe. But it's more about a service delivery, getting those services closer to the people. And I think that is really the crux of the matter. That is what we as citizens have decided to say, let's get together and make a collective effort to lobby and advocate for an inclusive process, not something where government is just saying we've set up a cabinet committee. Yes, we appreciate that they see this as a very important issue, but then to what extent do I, as an ordinary citizen, have access to that interministerial committee? But I can walk into the NPRC, the National Peace and Reconciliation Commission. I can't do that to a cabinet committee.
Right, and now we are now joined on the line by Thembelani Dube. He is the Executive Council Secretary for Administration from the Bulawayo Progressive Residents Association. Thembelani, welcome to the Mint Special.
Thank you, sir. How are you?
I'm fine, sir. How are you today?
I'm good.
Now, Thembelani, Bulawayo as a city has faced perennial water problems spanning years. The Zimbabwe government's devolution framework has been economic and has already begun dispersing the 5% intergovernmental fiscal transfer devolution funds to assist in service delivery. As an organization and a member of the Citizens Task Force on Devolution, how do you think devolution can assist in ensuring that the water challenges that your city is facing can be resolved utilizing devolution funds?
Let me start by saying that devolution is a good thing. As enshrined in the Constitution of the Republic, devolution will bring administrative autonomy, it will bring fiscal autonomy, it will also promote transparency and accountability. Now, with reference to Bulawayo's water perennial problems, you find that we need funds so that we can, one, add our dams, the number of dams that we have, because right now we are talking about the Kwaishangani Dam that needs to be connected to the Bulawayo City Council water supply. And then we also talk about the Nyamandlovu aquifers, which need to be repaired in terms of boreholes being repaired. So when we are talking about devolution, we think if it is fully implemented, then the water situation in Bulawayo can be improved because, one, the resources will be readily available. Two, the ideas that will be generated by the councils, that is in terms of those who will be running this, the council, the devolution council, can help in solving the problems that are faced by Bulawayo. Because currently the challenge is that, as we heard in the past few weeks, the city has to look for resources from the central government, and it takes time for those resources to be released.
Right. Now, you make a very good point, and I think one of the big projects that's been talked about in your area for a long time is the Zambezi water pipeline project, if I'm not mistaken. I think you would probably have a comment on that. But I understand as well that one of your remits on the task force is looking into social housing. So what exactly is that? What exactly is the problem you want to solve? And how will social housing be affected by devolution in the context of COVID-19?
When we are talking about the issue of social housing, we are simply referring to the houses that are affordable to the low class, to the middle class. We are also talking to the number of people who are waiting in the housing list, because when these stands are being released, you'll find that most of the people who will be on the waiting list don't benefit, but those with money, those with resources do benefit. And also when we are talking about social housing, we'll be referring to geographical space. How is it used? We propose that maybe if we can have a vertical development instead of a lateral development, then that can assist our people to have a housing. And then with regards to this COVID-19, you'll find that what we had planned is now not being implemented because people cannot meet their leaders. We had planned meetings so that the local authorities can actually engage with the masses so that they can explain. We can also explain our plans to the masses so that the local authority can synchronize our ideas for the benefit of the people. And at the same time, we are saying that because of COVID-19, the idea of selling devolution to the masses has been halted because we can't meet the poor residents. Yes, we can have platforms like Zoom and so forth, but the majority of the people do not have enough money to buy the data for that for those platforms.
Thembelani Dube, Executive Council Secretary for Administration at the Bulawayo Progressive Residents Association. Thank you very much.
Thank you very much.
Now, you heard what Thembelani was saying there, and something struck me. First, of course, he's saying that they were calling for dialogue between the local authority and the people, and that didn't seem to happen. So it means that there's already a disconnect between council or provincial governments and the people. And he also talked about affordable housing, and I think it's critical, people to have housing. In other words, you need a place to live before you can start developing. David, your comments.
Yeah, you see, this issue of affordable housing is important, because if you don't have that kind of process where people can get access to housing, the next thing you are having shanty towns. And in a COVID-19 situation and with the public health problems, you remember we had this 2005 Mrambatsina, and some of the narrative was, look, we are trying to avert a public health disaster.
Which included cholera, which came up recently, didn't it? And fevers.
And so all these social service delivery systems are critical in order to mitigate some of these public health disasters. And I've already alluded to the fact that last year it was Idai, this year it's COVID-19. Who knows what's going to happen tomorrow? And that is when the delivery systems of these services becomes very critical.
Okay, thank you. We're jumping all over the country here because this is such a critical discussion that we have to talk to everyone around the country who's part of the association or the trust that's here. Now, we now welcome Edson Dube, who is the Programs Officer for the United Mutare Residents and Ratepayers Trust. Edson, welcome to the Mint Special.
Thank you.
Edson, I understand that there will be a provincial devolution summit in each of the major provinces, that's Harare, Manicaland, Masvingo, Bulawayo, etc., to gather views on possible devolution implementation models, which will be consolidated and presented to the government for consideration. Now, United Mutare Residents and Ratepayers Trust, as a member of the task force, held its summit in March 2020 of this year. What are the three main stakeholder devolution issues that emerged from your summit and that tie in as well with response to COVID-19?
Okay, I think maybe what was very clear in Mutare when we held our devolution conference was that the residents would want to see locals retaining the power to determine what happens to resource allocation. That is number one. They also were very clear that they would want to see greater decision-making coming from the people at the local level rather than the national. That is number two. And then the third one, it was, the residents were very clear that they would want to see development initiatives being spearheaded by locals within the province of Manicaland and not central, that is Harare.
I mean, those are really great points, because in essence, what the people in your area are saying is that let us have control of our own destiny and use the funds to shape our own destiny, because we know what our issues are, where we stand.
Definitely.
Now, I understand as a member of the task force, one of your responsibilities is to look at road and transport. So the question is, has the existing road and transport system affected the fight against COVID-19? And what needs to be done to improve this, particularly bearing in mind the discussion today around devolution?
Yeah, I think the state of roads is very deplorable. One would be quick to point out that most of the roads in Mutare are impassable. And one would then question whether it is possible to quickly get someone to a quarantine center or to a hospital in light of the fight against COVID. I've been talking to several residents who actually felt that the recent resurfacing of First Street was not a priority. They should have rather concentrated or focused more on the major road that links St. Joseph's Hospital to Mutare infectious disease in light of the fight against COVID-19. Now, because people were not properly consulted, or rather were not at all consulted, the resources that came through from Zinara have now been allocated to a road that is not at all a major road and a priority at this hour. You find that people then continue to clamor for devolution to come as soon as yesterday, because if they were involved in the disbursements of the funds, if they were involved in actually prioritizing which road they wanted resurfaced for easier access to hospitals and any other medical facilities, you'd find that it would have never been First Street, and probably the budget that came from Zinara would have been probably used to maintain another road.
I mean, you heard in my preamble at the beginning of the show the issue of health and how if you had to be tested, there's only 2 centers at the moment, one in Harare and one in Bulawayo, and anyone in your area, if they were tested, the tests have to come to Harare for that. And health and the primary health care is a critical part of devolution. What would your comment to that, and what's the situation where you are in Mutare?
Well, I can agree with you more. Mutare has got one facility which is almost complete, which will have 10 beds, and then it got an allocation of 2, a donation of 2 ventilators last week. That is Mutare Infectious Disease Hospital. As we speak, it is still under rehabilitation, and a lot of work still needs to be done. And then to say a province of more than 1 million people like Manicaland has a holding facility of only 10 beds. I think this then points to a situation where you would rather have had these things being done by a local authority rather than a national authority. Because at the end of the day, you find that everyone will be driving up to Harare with either tests to Wilkins or maybe with surplus patients. That is in a case where we would have exceeded 10 that can be held at infectious disease hospital. So I think I cannot agree with you more. The situation in Mutare is still very, very worrisome, and we are hoping that we don't get cases of COVID-19 anytime soon until we are very ready.
Well, let's hope that doesn't happen. Edson Dube, Programs Officer for the Mutare Residents and Ratepayers Trust. Many thanks for joining us here on the Mint Special.
Welcome.
Now, he made some fascinating cases there. I mean, I think the one that struck is 10 beds in the whole of Mutare. I mean, that's just us in the studio, isn't it, really? Yeah. But, I mean, let's talk about how devolution really is an enabler. I'd like to ask you this, David, and then I'd like to go to health for you, Lorraine. It's an enabler. In other words, the money isn't meant to have this huge economic growth. It's meant to enable so that business can do better work, citizens can have better facilities. Yeah. What would be your comment to that?
Yeah, my comment is to say, had we implemented devolution even earlier, some of the problems that are now emerging in the context of COVID-19 would not exist, because devolution is about sharing power or removing power from the center to the periphery, and this power may take the form of decision making, political power, also fiscal power. So where you see, money should always be closer to where the action is taking place. When within a devolution framework, when you put money into the local authority area, they are more in tune. They know more about what priorities to allocate that money. And perhaps some of those run-down hospitals would not be run down had devolution taken effect earlier.
Let's talk health, primary health care. I mean, it's critical, and I think COVID-19 has highlighted that. Devolution would and should have helped with that, particularly in the major centers, and not just the major centers. Let's not forget, we're talking here about the whole province, not just cities. I think that's critical. Lorraine?
Yeah, so you find that when I first described the devolution framework, I was saying this is where the national government devolves its functions and powers to subnational governments. So you find that in terms of primary health care, if the local authorities had the control over resources on health, they would be able to quickly respond in terms of disaster preparedness to the COVID-19 pandemic. The level of preparedness would be much higher. And it also reduces the burdens on government, where they have to centralize everything and then oversee 10 provinces to ensure all of those provinces have the capacity to respond to the disease. So this is why you find that the government could only open up 2 testing centers within the whole country. But if the local authorities or the local governments within the different provinces had been capacitated to respond to national disasters or provincial disasters, to respond to some of these disease outbreaks, that would have enabled us as a country to ensure that in each and every province we have hospitals that can effectively respond to challenges in primary health care. So this is one of the most important things for the government, to ensure that there is that devolution. I'll give an example for Harare, where the government took over Wilkins and Beatrice infectious from the Harare local authority. And then the nurses who work for Harare City Council decided to down tools. So these are some of the challenges that we are talking about. Allow the local authorities to make decisions because they are closer to the people and they have a better understanding of the challenges that citizens are facing.
I mean, that's what Edson Dube, the programs officer from Mutare, said, really. He said, let the locals in the provinces make their decisions, and they'll be, and because they know what's happening on the ground. Now, unfortunately, we're going to have to take a breather from this very exciting and very critical and important discussion. You are watching the Min Special, our discussion today, devolution in the context of COVID-19. This broadcast is brought to you by Zim Papers TV Network, ZTN, and our partners, the National Citizen Devolution Task Force, represented by the We Pay You Deliver Consortia. We'll be right back. Don't go away. Welcome back. This is the Min Special. Our discussion today, devolution in the context of COVID-19. This broadcast is brought to you by Zim Papers TV Network, ZTN, and our partners, the National Citizen Devolution Task Force, represented by the We Pay You Deliver Consortia. Now, we now are joined by fresh additions to our panel. I'd like to welcome to the Mint Presha Shumba, Director for the Harare Residents Trust, as well as Fadzai Trakino, Director Women in Law in Southern Africa, Zimbabwe. Welcome to the Mint Special.
Thank you.
Thank you.
Now, Fadzai, I'd like to just really talk to you now about the legal perspective of this. What do you think needs to be done to ensure government progressively devolves power to other tiers or levels of government so that remote communities do not overly rely on the center, particularly in the area of COVID-19 pandemic, which has restricted movement across districts and provinces and, of course, has affected our people's livelihoods?
Well, thank you so much for that question. So you find that the Constitution already sets the framework in which devolution is supposed to happen. Section 264 already provides for that. But what now needs to happen is that there needs to be an alignment of the legal framework that is currently existing to what the Constitution already provides. That process is what has not happened yet since the coming in of the new Constitution. So what we are advocating within the task force is that there should be a speedy alignment of the necessary legal frameworks, and there are a number of laws that need to be aligned with the Constitution for devolution to take place. The Urban Councils Act, Provincial Administration Act, Rural District Council Act, amongst others. All these are not really speaking to what the Constitution provides. So there's a mismatch in what the Constitution says on one hand, in what is currently happening on the ground, because there is no legal framework in which the devolution that is provided for in the Constitution should follow. So it's one of the big steps that government needs to do, and this process needs to be led by an independent commission. That's what we are really calling for, because there are a lot of vested interests from political parties, citizens, private sector on how it unfolds. So it becomes very imperative that whatever institution leads this process is very objective and is able to listen, and that's the most important thing. It has to be a participatory driven process, otherwise it can be very messy when everyone's interests are not taken into consideration, and there's no balancing of those interests within what the legal framework would then put into being.
I mean, one concern, I think, by citizens, if I move to Precious, of course, is misallocation or misspending of funds or abuse of funds, which has been a case in councils before. And Precious, you can also comment on this afterwards. How legally can that be at least contained or tried not to happen? Because it has happened in the past.
So you find that the Constitution also provides already for a 5% amount that local authorities should be given, which is a first step. But we're saying that if we go the full scope of devolution that it sets within the objective itself of the Constitution, it says to ensure the equitable sharing of local and natural resources. So it's beyond just the 5%. So we are also going to have another legal framework or a policy framework to do with how these resources can be shared beyond just the 5%. We know that at the moment it's national government that actually administers all revenues through the Ministry of Finance, through a budget framework. The local authorities also have their own mechanisms. But for a devolved, within a devolved government, you notice that there is also a separate framework that deals with how these funds are allocated. At the moment, I don't think citizens are quite aware how this 5% has been allocated. What are the principles that this that they've considered in terms of equity? We know the funds have been set aside. The minister even stated in the budget for 2019, even for 2020, that this allocation has been made. But to actually track it through and say this is the 5%, it's not very possible at the moment. So that framework needs to be there. It has to be a transparent process where we all actually see how it has been apportioned, and we are able to track these resources. And one of the things that we can do, like other countries, is to even ring fence local authority revenue, to say this particular resource, if it is the 5%, which are the priorities that local authorities also can further look administer utilizing that 5%. So these are some of the things we need to do.
Precious, it's interesting what Fazai was saying there. I mean, there seems to be a gap between what we know as devolution and what the ordinary citizen in different provinces knows about what devolution is. The communication between the local authorities and citizens, or government and citizens. That's my first question. And secondly, of course, primary health has now become critical. I mean, with COVID-19, primary health care centres are needed more than ever. We heard in Mutare they only have 10 beds, I think we were told by Edson. How do you think devolution can assist in making primary health care centres equipped to screen and rapidly test patients? And of course, as I said, my first question, that communication gap, how can we resolve that?
Thank you very much. My reading of the presidential guideline on devolution reflects a government concerned with the direct control of every aspect of the governance infrastructure in Zimbabwe. There is this emphasis that Zimbabwe is a unitary state, that they will from time to time determine what kind of powers and decision-making authority would rest with the different tiers of the new structure within the devolution framework. So from that communication, I find the president's message diluting the thrust for letting go a significant chunk of government's powers and control over the affairs of the local citizens. At this stage, however, we need to be guided by the Constitution. The Constitution is specific that we need to devolve it, not deconcentration. The kind of thrust that is apparent in the government's implementation is like allowing its own structures as central government to be present in our local communities and making decisions, excluding that institution, the local authority, those local structures that have been established by the Constitution to deliver appropriate services. The reason being they are the local unity closest to the citizens. It means that whenever the citizens have an issue of, say, transport, we have congestion. Suppose we are finding challenges in our clinics. We want to know what is happening. We don't go to Mr. Government. We go to the councillor. We go to the district officer and the whole structure. And it is that situation that has left us with so many questions. When does the council communicate with the citizens about the need for a devolved system? Do we have the council understanding what would be its role when devolution is finally implemented? What we have noticed is that the bureaucrats in local authorities have a deconcentrated approach where they would want to retain all their powers and they do not want to cede that decision-making authority to the citizens.
But that brings us to a point. I mean, I think some of our other panelists have talked about the bureaucracy.
Yeah.
So with such an existing bureaucracy in the city councils already or provincial governments, how possibly can that be amended or changed that devolution can be effectively rolled out if that bureaucracy is there? Because it will still be there when devolution now and the funds are coming and devolution has come out to the provinces.
This is one of the downsides of devolution that a lot of scholars have raised in the past. People like Rondinelli have written extensively around devolution. These challenges of bureaucrats and local policymakers monopolizing decision-making, these are realities. And it would require the government to be genuine in its implementation of devolution. We need strong structures that respond to the citizens' issues, that allows for active citizen participation, that allows for direct interaction of the different structures. We do not want to have a situation where the citizens' authority is surrendered to the central government. We can delegate, but we will never have to surrender our authority because the sovereignty rests with the citizens. So it is that situation that is probably the downside to devolution, because the bureaucrats at local level and the policymakers could begin to actually create their own small fiefdoms at the exclusion of the citizens. But overall, we are pushing for the implementation of devolution as is outlined in the Constitution in the first instance, before we begin to talk about the challenges that would come.
Let it come, and then we can see how we can work it out.
Exactly.
Now, before we cross over to Mashvingo, David, a comment. I know you want to make a comment.
My comment is to say that this issue of local bureaucrats can be resolved by legislation. You know, just because in any case, the
the Constitution talks about involvement of the people from the planning, implementation to the monitoring and evaluation. And these things can be paneled, beaten inside the Constitution to avoid this downside aspect, which
I think legislation, oversight, transparency,
Yes,
accountability,
yes.
and as we said, the voice of the people
The
being
voice of the
heard
people.
by the locals.
yeah, that's the principle.
That's the
voice
principles.
of the people.
Now, we're now joined by Godfrey Mtimba from the Mashvingo United Residents and Ratepayers Association. Godfrey, welcome to the Mint Special.
Thank you, Andy.
Well, we have been going all around the country, Godfrey. You won't be the last stop, but welcome. Now, what has been the state of service delivery by the local authority in the almost 2 months of lockdown and subsequent travel restrictions? And how do you think a fully devolved governance system would have helped and can assist in future natural disasters such as the COVID-19 pandemic?
Okay, thank you very much. Our service, the state of service delivery in the past 2 months here in Masvingo, we have actually seen a slight improvement of service delivery since the pronouncement of the coming of the coronavirus pandemic. Prior to the national lockdown, the Asian city, we have been facing a severe crisis of water shortages. After the city council introduced water rationing, which saw us receiving water only twice a week. So we spent most of the whole week with dry taps in our houses. But when government announced national lockdown, the city council moved swiftly to provide water, and we are now having it on a daily basis. But we're still having some challenges because we have it for only 2 hours in the morning, in the wee hours of the day, and we spend the rest of the day without water. So this has implications in the fight against coronavirus spread, because the recommendation are that we must constantly wash our hands using water and soap or with sanitizer. So in the event that we don't have water the greater part of the day, our efforts to practice hygiene are compromised. We also had some challenges with refuse collection in the city, and but
Okay.
now yes.
Now,
But now,
sorry, just to quickly move on, because unfortunately we're running out of time here, but very quickly, refuse collection, solid waste management. I think you're a member responsible for that in your area. So,
Yeah.
I mean, how is that? How are we prepared for that natural disasters such as COVID-19? How does it bring in that, how important refuse collection and waste management is? I must say, I have to ask you to just be quick about it.
okay, in the case of natural disasters like COVID-19, refuse collection should be prioritized because it is one sector that requires a great deal of hygiene and sanitation. So if we're fighting diseases that require sanitation, refuse collection should be prioritized. But because of centralization, city councils have challenges in making it to these priorities, because they need to seek authority from the central government to their budget, so that they can put more resources to refuse collection and waste management in times like this. If it was a devolved state, city councils could simply make a decision at local council and channel more resources to refuse collection and waste management, so that they ensure that the safety of residents are ensured. There are a few health risks, because this sector actually has a great deal of it actually has implications on the health of residents, especially in this time where we are facing this dangerous pandemic.
Now, Godfrey, it's interesting because obviously devolution cannot be all sites fits all. All different provinces have different requirements and different needs.
Yes.
So if I had to talk about Mashvingo, what would you say, your province or the province there, what are the main issues that they would like to see covered by devolution, the things that the province would benefit the most from devolution?
Yeah, in Masvingo, the issues that we are facing right now, number one, we have got water challenges. The way our budgets are done, the money that we need as residents from council to procure procure chemicals to clean our water. The city council has to apply from to central government through the Reserve Bank. So there's bureaucracy in that process and takes a lot of time. We think if the system was devolved, city council should not seek authority to buy to have foreign currency to buy chemicals to treat our water here. This should be done locally, and I think such issues would be our priorities in Masvingo. And also the issue of refuse collection and waste management. We have a challenge that our dump site is located in the midst of residential areas in Nyararo West and Victoria Range. So we have been calling city council to move that dump site to another site far away from the residents, but they have to seek authority from the central government, from the Ministry of Land, so that they are given another farm to have a dump site. Now this has taken over five years, and still residents are facing a health risk because children and other people visit the dump site to collect some material for recycling, and this is a great risk because people might end up spreading disease, especially in this time that we are facing the COVID-19 pandemic. So if the city council and other local government departments get the powers to give city council alternative land, we should not have been waiting for 5 years. So I think these things should be decentralized so that we make quick decisions that helps us instead of waiting for several years for the central government to make decisions for us.
Godfrey Mtimba from the Masvingo United Residents and Ratepayers Association, many thanks for joining us on the Mint Special.
You're welcome. Thank you.
Now then, that was interesting. Godfrey talked about some of the issues that they had in Masvingo. Primarily, he talked about the water. I think that seems to be a huge problem. Only twice a week, waste management challenges, also foreign exchange challenges, I think, to get the chemicals and having to apply to central government as well. Health risks from getting unsanitary or unclean water, from dams and so forth. And also, devolution to make quick decisions in the province. President.
Yeah. So our major challenge presently is this highly contested space between the central government and the local authorities. It would seem that in the wake of COVID-19, the government, instead of strengthening the capacity of local authorities to deliver on health, they were trying to create parallel structures, neglecting the council health infrastructure. Yet even before the COVID-19 outbreak, the local authorities, for example, Harare's health centers are servicing people from Chitungwiza, Lomboshawa, Epworth, Murewa. They come here, Zimba, Mazowe, they come to Harare. But it doesn't appear like the government's thrust is to strengthen urban local authorities to deliver. Instead, they would be talking about an alternative. You see, the amount of money that was invested in that place, what's this, for COVID, they said it is private. But
St. Anne's or
St. Anne's. Oh, okay. They could have invested in the city of Harare's infrastructure. Wilkins, Mavuku, Warren Park, and all over, hopefully. Currently in Ward 1, Harare South, we do not have a proper health center. In Ward 46, which is also contested because central government has maintained it as a ward in Goromonde Rural District Council. Yet they expect the city of Harare to deliver health services in such a community.
So the question is how will devolution get that, or at least clean that up?
It gets clarity on the functions, on the roles of each unity of government. It gets clarity on the roles and responsibilities of the local, on the provincial, on the national. We cannot have a national government coming to try to talk about paracetamol, access to a person in Hopley. We want central government to create a policy deals with UN agencies, helps local authorities, and then the local authorities, the policy making must emerge from the citizens, their bureaucrats and local policymakers. And when we make the presentations, there are levels of governance. But what we are witnessing, for example, the urbanization, the transport crisis we are witnessing, crowds and crowds are stranded daily. But central government is telling the nation that ZUPCO will deal with that situation. That is unimaginable. It shows lack of foresight. It shows lack of understanding of what devolution means. Devolution means relinquishing a lot of the powers from the center to the local, so that me as a citizen, I walk up to my mayor, Herbert Gomba, and tells him, we have a problem in our community. And the mayor is talking to his councillor, and the councillor is coming back to the people, and the people are free to approach their councillor. Not this situation where my councillor, my mayor, my town clerk, they are handicapped. They can't make decisions.
They have to go to central government
They
to get
have
things done.
But the central government is already overwhelmed. They have demonstrated from time to time that they have no capacity on their own without the local infrastructure.
David, let me bring you in there.
Yeah, the whole issue is about a whole state redesign. You are not just talking about something very simplistic. Yeah. So you have to put in place a process which, in which you invest enough thought on how you will systematically implement devolution. This rather ad hoc approach isn't going to get us where we want to be as a nation.
Okay. Now, Fadzai, interesting, because one thing we've talked about, I want to be specific now about gender. I think it's critical. So a two-part question. Gender, how has it been affected by the COVID-19? And also, will devolution assist provincial governments to address some of the gender issues that we know exist at the moment?
Well, within the COVID-19, we've just really seen in amplifying, or rather the gendered nuances in terms of discrimination, in terms of lack of access for women being more magnified. Not that these were not existing, but they've just really been amplified. The fact that women are overburdened with multiple or triple roles in the burden of care work, and this has really been further magnified by lack of access to services, which is why we continuously hammer on issues of resources, and devolution being one of the issues that could possibly help in that. So when you don't have access to water in a particular area, women have to go or walk further or stay in longer queues and further expose themselves sometimes even to gender-based violence and other issues. So these are the things that we continue to witness. But also because within some of those long protected queues, there's no water marshal, there's no one monitoring how water is being accessed. There's a lot of exploitation for women as well. They have to pay, sometimes even with their own bodies, to be able to access just a basic service like water. So these are the areas that we have in terms of concern. And also just the fact that they are also further exposing themselves to the risk of contracting COVID-19, because not everyone is wearing a mask there. So just the exposure. So when we are talking about gender, this is where now we think that, and we really feel strongly that within a devolved government, we can re-emphasize issues related to representation of women within all the structures of government. And this is not something new, it's something that is already within our constitution. Section 17 talks about representation or gender equality in all structures of government. So when we talk about a devolved government, we also need to re-emphasize that representation to come out.
So would you call, I just want a one-word answer, yes or no, would you call for specific devolution funds to be earmarked when it gets to provincial government level at that gender issue, or at least towards women specifically? Would you call for that?
Definitely, because we'll talk about ring fencing of gender resources as well.
There we go. The answer is yes. Now, unfortunately, we are coming to the end of our show, but David, the final word. What does the country stand to benefit from devolution? And of course, how do we, the citizens, get involved? But more importantly, what policy recommendations would you propose to the central government to make sure devolution works effectively?
Okay, the first issue in terms of benefit, certainly it's all services are closer to the people. The delivery process will make it more efficient and effective. And then in terms of the citizens, the message that we are putting out there is that citizens must engage this devolution agenda, this issue, and help us to lobby government for an inclusive process. And then the recommendations that I would make to government is that they really should create institutions which are more independent, yes, in order to drive the process of devolution implementation.
Well, we've come to the end of our show. You have been watching the Mint Special, our discussion, devolution in the context of COVID-19. We'd like to thank our panelists, David Matumbike, National Coordinator, Local Governance Trust, Precious Shumba, Director, Harare Residents Trust, Godfrey Mtimba, Information Officer, Mashvingo United Residents and Ratepayers Association, Fadzai Chakwino, Director, Women in Law in Southern Africa, Zimbabwe, Lorraine Mupasiri Sani, Director, Combined Harare Residents Association, Tembelani Dube, Executive Council Secretary for Administration, Bulawayo Progressive Residents Association, as well as Edson Dube, Programs Officer, United Mutare Residents and Ratepayers Trust. As you can see, our program, we covered most of the country today, which is fantastic. This broadcast is brought to you by Zim Papers TV Network ZTN and our partners, the National Citizen Devolution Task Force, represented by the We Pay You Deliver Consortia. If you have any comments or views on our show today, please contact us via our Facebook page, Zim Papers TV Network, or via our Twitter handle @ZTN News. Now, a final comment. In the early days of the pandemic, Bulawayo sadly lost a patient. The patient reported to his GP on March the 23rd and got tested on April the 2nd, 10 days later. His results only came 3 days after his death and almost 2 weeks after he got sick. Could his life have been saved if the country was devolved and Bulawayo had access to the same testing facilities that Harare had in those early days? This is one classic example. COVID-19 has only reminded government of the need to expedite the devolution process. Yes, Treasury has asked provincial councils and local authorities to craft developmental programs that inform their expenditures to be funded through intergovernmental fiscal transfers. But has this been followed through? Nearly $140 million has already been dispersed to all 92 local authorities towards devolution implementation. But is this enough in the face of a global pandemic that has claimed 4 lives in Zimbabwe already? The Zimbabwean government announced a well-timed stimulus package of 18 billion Zimbabwe dollars. It's around 360 million US using the official rate on May the 1st, 2020. How much will go to provincial councils and local authorities? These questions need to be addressed if the country is sincere about executing its overdue devolution agenda. It remains to be seen if the pandemic will usher in an eagerly awaited era of devolution and decentralization of services. Zimbabwe's devolution program is largely founded on the principle of empowering provincial government councils to spearhead economic and social development projects in their areas by leveraging on local resources. It's time to let them do exactly that. I'm Andy Hodges. Goodbye, and you all be safe. The